Alright, so what is a root canal? A root canal is basically a filling in the part of the tooth that you don't see, which is the root. The root is underneath the bone and the gums. It's really no different than a filling that you get in the crown portion of your tooth, which is above, where we remove all the diseased portion of the tooth. We disinfect it and then we seal it up with a filling material. So it sounds a lot worse than it really is, but it's pretty much the same as just getting a filling. It's just in a different part of the tooth. Why do we get a root canal? Damage to the nerve. There's a couple different reasons why we get this damage. Number one can be trauma. If you get hit in the face playing sports, always wear a mouth guard. One of the other ones is decay. And the last one is when we see cracks on the tooth. The most common symptoms of a root canal are hot and cold sensitivity, biting pressure, or a lot of times we'll also see some swelling. Most of the time you're going to know that there's something wrong with the nerve of your tooth, and most of the time when people come in they already know that they're going to end up maybe getting a root canal. One really important thing to remember is root canals are not as bad as media and maybe your grandparents have told you they are. In the past we have to use these little tiny files and we'd use our hands and it'd take hours and hours and hours. Now we have these really cool tools that they have motors on them. The anesthesia is a lot better. Like I said, it's just like a filling. We get you numb, you shouldn't feel a thing, and it should go pretty quick. With the new tools we have, it usually goes in about half the time, sometimes as little as half hour for a root canal. Here at MFDA we've got several dentists or doctors that do perform root canal therapy. Like I've kind of talked about through this procedure, it's really pretty simple. We get you numb, sometimes we stop, we take x-rays, make sure we know where we're at, and then we put usually a temporary filling in at the end to make sure everything's feeling better, and then at the end, a couple weeks later, we have you back for either permanent filling or for a crown. So if you hear root canal, it's not the end of the world, we'll take care of you.